How can you catch monkeypox and what is it? Investigations are being conducted into cases of monkeypox, an uncommon and little-known illness, in the US, Canada, Australia, the UK, and other European nations. Over 1,700 verified cases in the UK have emerged in recent weeks. Although the majority of cases are minor infections with little risk to the general populace, the UK government has purchased smallpox vaccine to prevent monkeypox. Monkeypox, how common is it? The monkeypox virus, which belongs to the same virus family as smallpox and is what causes monkeypox, although it is considerably less severe and the likelihood of contracting is low. What causes monkeypox? The majority of its occurrences are in isolated regions of Central and West African nations that are close to tropical rainforests. Since the year's beginning, there have been over 1,200 instances of monkeypox in those areas. The virus is known to have two main strains, a milder West African strain and a more virulent Central African strain. The milder West African strain is the one that is currently spreading throughout the world. Monkeypox is currently spreading throughout the society as evidenced by the extremely high number of persons outside of Africa who have contracted the disease without having traveled there. Anyone worried they might be infected is advised to call NHS 111 or their local sexual health clinic, but telephone or email in advance of a visit, according to the UK Health Security Agency. As a precaution, it is also encouraging persons who are infected to use condoms for 8 weeks following an infection and to refrain from having sex while they are experiencing symptoms. What signs and symptoms are present? Fever, headaches, swellings, back pain, and sore muscles are some of the initial symptoms. After the fever subsides, a rash may appear, frequently first on the face before moving to other areas of the body, most frequently the palms of the hands and soles of the feet. The rash changes and progresses through various stages before finally forming a scab, which then peels off. The rash can be extremely itchy or painful. Scarring could result from the lesions. It takes between 14 and 21 days for the infection to typically go away on its own. How do you catch it? When someone is in close proximity to an infected person, monkeypox can spread. The respiratory system, eyes, nose, and mouth are only a few of the entry points for the virus into the body. Although it can spread through close contact, it has not yet been classified as a sexually transmitted infection. Anyone who has the virus is advised to avoid sex while they are experiencing symptoms, according to advice. People who have been diagnosed with monkeypox are recommended to use condoms for 8 weeks following infection even though there is currently no proof that the virus may be communicated through sexual fluids. Additionally, contact with infected animals like monkeys, rats, and squirrels as well as objects like bedding and clothing that have been exposed to the virus can spread the illness. What level of danger is it? The majority of viral cases are minor, occasionally resembling chickenpox, and they go away on their own in a couple of weeks. However, there have been reports of deaths in West Africa due to monkeypox, which can occasionally be more severe. Is there a higher risk for gay men? Even though some of the cases have been reported in gay and bisexual males, the virus can spread to anyone who has intimate contact with a monkeypox victim. According to the UK Health Security Agency (UKHSA), gay and bisexual men make up a notable proportion of the cases that have recently been reported in the UK and Europe. As a result, we are particularly encouraging them to be alert to the symptoms and seek help if concerned. Monkeypox, giving health advice without embarrassment. How often do outbreaks occur? The virus was first discovered in a domesticated monkey, and since 1970, intermittent outbreaks have been documented in 10 African nations. The first time it had been noticed outside of Africa was in the US in 2003, where there was an outbreak. Patients contracted the illness after coming into close contact with prairie dogs that had been contaminated by foreign small animals. There were 81 occurrences in all, but none of them resulted in fatalities. The biggest epidemic ever recorded occurred in Nigeria in 2017. There were 172 possible cases, and 75% of the victims were males between the ages of 21 and 40. What is the procedure? Infection control is able to stop outbreaks. It has been demonstrated that the smallpox vaccine is 85% effective at preventing monkeypox. To lessen the likelihood that symptoms would manifest, some high-risk close contacts of persons who are sick will be given one of the 20,000 doses of smallpox vaccine that the UK has purchased. Antiviral medications may also be helpful, and the UK has approved tecovirimat for this purpose. Should the general people be worried? People who have had close contact with confirmed cases and are at high risk of being contacted by health protection teams. They are guiding them and keeping an eye on them. Anyone else who has come into contact with someone who has the disease is advised to isolate at home for up to 21 days.